was just a routine checkup, and how we were just chatting, and then during the physical examination, he realized that he felt a mass. And of course, I was just frantic, obviously, right away. And he said, well, I'm not positive it's malignant until we go in there, but if it is malignant, I want to bring in Dr. David Mutch, because he is the best oncologist for for ovarian cancer.
We were concerned that there was a high likelihood that this would be an ovarian cancer, and for that reason we recommended surgery at the medical center here, Siteman Cancer Center. We were able to remove all of the disease. That put her in a very good prognostic group.
They know more and more how to give you a chemo that doesn't make you as sick as it did years ago, and will go straight to the cancer and won't affect as many of your other organs. And I know that he considers that and will make up a special regimen for each patient. We really feel like we've been in the best hands. And I've actually had 3 recurrences, and each time I had chemo. One time when I had a reoccurrence, he was out of town for a conference. And that night, about 9 o'clock, the phone rings, and it's Dr. Mutch calling me from Maryland, I think it was.
I called her and let her know that her tests were abnormal, but whereas it was not the news that she wanted to hear, that there were many treatment options available for her, and that we would work through this together and figure out a treatment that was best for her and treat her disease.
It was so personal, and it was just so nice that, it just makes it much easier to deal with, all the procedures that you go through for this.
One of the biggest benefits of being at a place like Washington University and Siteman Cancer Center is that when Mrs. Sallar recurred in the lung, I was able to ask Dr. Patterson, a world expert in lung surgery, to resect that disease, which he did, and then we were able to follow it up with additional chemotherapy.
After my 10 years of experience of dealing with Siteman and the recurrences that I've had, that my treatment has just been fantastic. I can't imagine there would be any place where I would feel like I was in better hands because of the care that they give you, but it is care that is done intelligently. It's based upon knowledge and understanding of what I need and what should happen next. And that's based upon science, not just on making somebody feel better. So I'm just glad that I was affiliated with Siteman, and I've been able to go to them for all these years.
We have patients now who are living many decades with their ovarian cancer, as opposed to 2 decades ago where survival of ovarian cancer was measured in the months and not in years or even decades. And such is the case with Ms. Sallar. She has been treated with multiple different agents over the years that we have learned, thanks to clinical trials, that have led to her more advanced treatment.
I'm in really good shape. I have a wonderful family, and I have a full life. I can travel, I can garden, I can take care of or be with my grandchildren, and it's a very good life. My husband and I are very, very blessed.